Welcome to the Sound of Movement podcast. Today we've got a great show for you. We're going to be talking injury management specific for the back and neck. This is something that I've had a lot of experience with myself. I've suffered with chronic lower back pain, and we've now successfully rehabilitated many people with the same issues. What's up, everyone? It's time to rock. If you're new to the tribe, Rich is behind the mix, Phil's across the table from me, and my name is Rad. We are Unity Gym experts at turning driven people into athletes. This episode is brought to you by the Unified Movement System, the only online program effectively balancing strength, flexibility, and fitness so you can unleash your inner athlete. Get daily coaching bars, plus our epic foundations prep program and revolutionary structural balance blueprint to create your ideal program and optimize your performance. As a valued listener, use the link in the description to get your first month free. Also, I'm very excited to announce that tomorrow we have an epic 72-hour flash sale of all our rehab programs. So you can grab any of those and deal with those nasty injuries, hopefully once and for all. Now, before we get started, warm welcome if you're on the live stream in the UMS Movement Mastermind Facebook group. Leave a comment and we'll send you some love. Remember that anyone listening to this can join that group and interact with us while we're recording these podcasts live. And lastly, a shout out to our YouTube athletes catching the replay. Hit the like button to support the channel and subscribe if you like what you see. All right, joining us today is Phil White from ADPT Physio. How are you, bro?
Good. Yeah. Loving this self-indulgent week of injury talk. It's exactly, it makes me feel important. So happy days.
Yeah, there's some topics where you're kind of just sitting there nodding your head, and then there's also topics where I'm just sitting here nodding my head. And
good to have a good breadth of knowledge and skills. So.
Yeah, that's right. So today, spawned by one of our online coaching members.
Yeah, that's right. So yesterday I did a Q&A, and always love getting questions from you guys to guide the conversation and know where what people want to know about. And I had a question, a comment on yesterday's Q&A from Adam Eliani saying, "Damn it, I missed the Q&A," but he's posted a question in the online coaching group of which he is a member. And he said, "I don't know if I should ask this directly to him as it is an injury question, but I screwed up my neck bad from sleeping in an odd position 2 nights ago. It is mainly the left side and I can barely turn it or look up. I got through my squat day just fine, but my straight arm strength day I had to cut the workout short because of the pain. I doubt I'll be able to do bent arm strength day tomorrow. It's very frustrating. Should I just rest the next few days and do bits of cardio on my bike, or just to do something? Thank you." So this kind of spawned a bit of a discussion between Rad and I about what is it that would be most valuable that we can give. And this idea, like neck pain and back pain, is just such a common thing for so many people and can really put the brakes on your training and on your life when it gets really bad. So we thought it'd be a good little nudge to really cover the basics of neck and back pain and how to think about it and how to deal with it. But as Adam said in the beginning of this question, don't know if it's just directly as it's an injury question. That's right. Remember, this is a podcast, not a consultation. So please, this is just informational entertainment, not a direct consultation. So.
Yeah, for sure. Do you want to read it? You want to read?
I just did, bro.
Oh, you did. Yep. So look, my experience with back pain is that when I don't do enough, it gets worse. That's what I've gone. That's what I've dealt with. So I've had spondylo. It's funny, isn't it? Right? Since I've been with you, I watch out about throwing out these diagnoses. But I've been diagnosed with spondylolisthesis. That's what the X-rays showed. Which is, do you want to explain what that is? I'm sure you can explain it.
Yeah. So there's like a bunch of different words that sound that spondylo something's in the back, and there's a few of them, and people often get confused between which one. But the listhesis is basically when you there's a change in the structure of some of the bony structures in the back that just cause a slight malalignment. Well, not malalignment, just a different alignment. And
So for me, what it is, when you look from my side on an X-ray, my L5 sits posteriorly, which means it creates a big sway in my back, a big arch in my back. And you can really see it. I was quite shocked when I saw it because I always just thought, I've got a sway back, when I used to see myself in pictures or in a mirror. But when I saw it on the X-ray, I was like, wow, that's crazy. And what I found was that if I didn't exercise for a couple of days, my back would start to hurt. I would start aching. And if I'd go about a week or so or longer, it would become really painful. And I don't remember the last time that I haven't exercised for more than a week. It's been at least a decade. But when I get close to that week mark, that's when the pain really starts coming in. Now, we've had a lot of people come in to Unity Gym with what they consider to be really bad back pain. You know, they like when we do deadlifts and Jefferson curl is a highly debated exercise. Like whenever we post pictures of us doing a Jefferson curl, which is basically where you hold weight, tuck your chin to your chest and you curl down through the spine. So the weight is loading your spine as you forward flex. And I've had people come in and see that when I explained it to them and they said, no, I can't do that. And I said, why not? I said, I've got a herniated disc. And through the exercises that we show them how to do here, sometimes even from coming to see you, Phil, 6 months later, the same people are deadlifting their own body weight or even more. And this is somebody that when they came in, they were like, no, deadlifts aren't for me. I can't do it. And that's really to do with load management, isn't it, Phil? And just gradually increasing their load management.
Yeah, well, there's some really big picture things at play here, and it's why I think back pain is such an interesting one, and why I did want to have this discussion where back issues have this certain, status of all injuries as being one of the scariest and potentially most debilitating, which is totally true because you've got some pretty serious structures in your back with your spinal cord running down the spine from the brain, obviously, and that's controlling the show for the whole body. So obviously we do need to be really careful with back pain, but it sort of has, I think, led to this real fear in the health professionals of old about and current about loading the back, and through the culture it has become this real thing where people become scared of lifting, like using the muscles, like loading up their back, because they think that it'll end up with them being a quadriplegic. So I think there's some really interesting things here, and why Rad made that comment about like being aware of kind of throwing around diagnoses, because and with image, and this talk we've had about imaging a few times, is that when you become aware of like something that has a complicated sounding name, and you see on the imaging a morphological change, so like a structural change, that really imprints into your brain and becomes quite a threatening thing. And it's quite interesting how you said, like, before you got that imaging, you just thought like, oh yeah, you have a bit of a sway back, and you're like a stuntman, and you are in the army doing some like pretty serious stuff where occasionally you get back pain, but like it's when you see this imaging, when you get this diagnosis, that really imprints on you as something that is so threatening. And as we've talked about before with pain science a lot, the amount of pain you experience is very much related to your perceived threat, both subconscious and conscious. So, so there's been a lot of change in management around back pain, and a real move away from always going straight to imaging as being the first thing that you want to do when diagnosing back pain, because it can really lead you down this like mental path that is not very helpful. So, yes, that's a big picture stuff. And then looking at, I guess, a load management issue that, as I said, like people have become so tentative about loading up their back, and you see all those workplace posters saying like,
keep that straight back,
keep your back perfectly straight, and if you try and pick up a pencil without being in like exactly neutral spine while like doing a perfect arse to grass squat, that your back's going to fall apart. It's kind of become this quite pervasive thing that any amount of loaded back bending is your body can't handle it. So yeah, it's this interesting cultural shift that I think has started to happen around like that, understanding that actually loading the spine obviously in a progressively overloaded way is going to be the thing that conditions you to being able to handle load in the spine. Yeah. And I think even more so with Adam Meliani's question around the neck, I think the neck is even the main culprit of that, because deadlifts and squats are obviously a pretty mainstream exercise where you're targeting loading the lower back, but with the neck, it's something that we don't usually target in terms of like progressive overload strength training, unless you're a rugby forward who headbutts people for a living. So for some reason, like rehab principles kind of go out the window when it comes to neck pain, and people don't think to actually add strength. And I know your mate Aaron McKenzie worked closely with Anthony Minicello, the rugby player, about years ago for dealing with his neck pain, and it was all about building up strength.
Yeah.
And that was like, and it's crazy that that's something that's so wildly like out there.
Aaron's dealt with some really tough neck issues as well. He's posted X-rays of like a before and after from the work that he's done, and he didn't have the natural curvature in his neck. You could see in his X-ray that his cervical spine was instead of it being like that, it was kind of like this. And there was other diagnoses that went along with that, but
just to be quite clear, like the lack of a curve is not a diagnosis in itself, but like that doesn't necessarily mean that something's going to be
that's what I
painfully
meant.
dysfunctional.
There were diagnoses.
Okay.
I don't know what it
Cool.
was. There was herniated this, or there was fractured that, or whatever it was. And he's had a lot of pain for years, but the work that he's done to strengthen his neck, and you look at the X-ray now compared to where it was, it has actually changed the resting position of the spine of his neck.
And I'd say even more importantly than being able to see that visual change, like he is one of the most impressive athletes like that I've seen in terms of like what he can do with his body. So even more so than the fact that the X-rays changed, like he's not at all held back by.
Yeah. And if you talk about Anthony Minicello, if you're not from Australia, you wouldn't have any idea who he is. But in Australia, in the sport of rugby league, which is one of the most physically demanding contact sports in the world, I think, he went from being at the top of his field to being pulled off the training court, the field during training, from the physio running in after they got the X-rays back after he was describing pain, and he had a couple of fractures in his spine and a bunch of herniated discs and all that. But what had happened was, with one of the fractures, there was a chip of bone off that was floating 1 millimeter or 2 millimeters away from his spinal cord, and of course if that punctured or severed his spinal cord, he could be looking at being paralyzed. And he went from that, he got taken off the field, and a year and a half later, after doing this rehab with Aaron, he was back playing, bigger and better than he ever was. And he went on to being known as the greatest comeback story in rugby league's history. They did an episode on him on a current affair about how good his comeback story was. So if you can have a spine that's that badly compromised, then it's quite possible that your back pain can be dealt with. Yeah,
and so I think it comes down to this idea that with the back, like still understanding like what are the structures involved. So obviously you've got your passive structures and active structures is how I always break it down. So passive structures being ones that you can't contract no matter how hard you try. So your bones, your ligaments, your cartilage. In this case, it's going to be your intervertebral discs. And all of those structures are there doing their thing. And then you have your muscles, which are going to control your active structures. So your muscles, and then your tendons are going to be basically controlling the movement of those joints. And so what so often happens when people with back pain, they'll see, they'll get an X-ray or see some scans and say like, oh, I've got a disc, a disc bulge. And then the rehab plan often is like, okay, you need like, they think, okay, I need to stretch this and do more like low level, like, like yoga or get non-impact movements. And then, but when you think about the passive structures, they're there for basically backup at end range. And so when you're taking your body into full range and basically stressing those structures in a way that, you're using them as the main sort of system, that is pretty counterproductive. So whereas when you're building up the muscular control and if you can build up muscular control for obviously by progressively overloading through heavy movements like a really good technique deadlift and other back extensions, etc. If you can build up that kind of like raw muscular strength, but then also muscular control, similar things like the spinal waves that I'm sure you've all seen videos of Rad doing, and something like the Jefferson curl, where you're actually getting muscular control through range, then that means that those passive structures, so your discs and your ligaments and the bones, really don't have to do as much work, because the muscles are basically taking like the percentage of how much force is going through that system. So that's why we really are so big on building up strength. Like it's not enough just to rest and do low level exercises for the rest of your life, because your muscles will then, if you don't progressively overload them, they'll decondition. And if you decondition, then you'll have even less muscular control to support the joints, and therefore it'll be this like real vicious cycle. And that's how people become crippled with back pain. Is they just as you get weaker, it means you can do less, and so you do less, and then that creates more pain, and then that you increase your perceived threat, and you're suddenly in chronic pain territory, often on opiates if you're in America. Like it's this horrible thing. And so and as you've said it, like your back will start to feel pretty ordinary if you take time off, and that's, you've got that structural change, the spondylolisthesis in your back, but most of the time it's just really well controlled by muscles. And so
I think as well, Phil, that I think one of the big issues that a lot of people face when it comes to back pain is the macro and micro loading outside of the gym. Because like one of the things that when I first started suffering back pain, like debilitating back pain, I mean, I was in high school, and when I got at my worst, I couldn't walk properly for a period of weeks, where I actually had to walk with a walking stick when I was 17 years old, because the pain was so bad in my back. I was limping, and honestly, I was a 17-year-old with a walking stick. And that's when I started going to see chiropractors for the first time, and that's probably where I developed my love for chiropractors, because they helped me so much, at least with the symptoms of it. It would really help. And eventually the chiropractor said to me, "How do you sleep? Show me how you sleep." And I showed her how I sleep. And back then I used to sleep on my stomach with one leg raised up to the side. And she explained to me what was going on in my spine to be in that position for 8 hours or whatever it was that I was sleeping for. And then told me what would happen if I was sleeping on my back or my side. And I had to train myself to sleep on my side. It was a really arduous experience. I just couldn't fall asleep on my side, and it was weeks of just getting very little sleep. And eventually I trained myself to be able to do it. And that was a massive reduction in back pain for me. And I remember what Aaron was saying about with Anthony Minicello when he was training him. He was saying how they changed everything about his life. Like they looked at the kinds of foods that he was eating, and for chronic inflammation responses, and he was just filled with chronic inflammation. And they looked at the way he was sitting, and like got him to not be sitting in a way where he'd be leaning on one side, and got him to be sitting in a way where he'd be in more of a neutral spine. And it's just all these different things that sort of come into play. And I think a lot of people, when they get back pain that's chronic, they look for that magic bullet, right? Like the silver bullet, the magic pill, silver bullet. I'm getting two sayings mixed up there. Where it's like, what's the one thing that I can do that's going to fix this? And what I've experienced is that there's a little bit more to it than that. But learning how to make yourself strong progressively, the way that you and I teach people to, is a cornerstone of that by a country mile. That's what I've found.
Yep. And it's always going to depend. Like, not all back pain is equal, and generally when it's more chronic, so if it's been around for a longer time, it'll usually be harder. Like, it'll be a slower process of getting rid of it, and there'll be more factors at play. Whereas sometimes when it's an acute thing that just pops up once, then often there can be a silver bullet where it just is like, oh, you've just changed this thing, or you've just done this one thing wrong, and then that goes away. So it's a part of hopefully some information around for you guys. Like it is often that acute back pain that does get much better much quicker, but the chronic stuff can take a bit longer, and you do need a bit of it's like a longer time of trying out different things often. It's so cruel, isn't it, that sleeping can be something that causes so much pain with the back, and it's something that
it's really, for me, it's been a big difference. I mean, even recently, something that was a big difference was I went from sleeping with one pillow to sleeping with two pillows, because I just looked at I was analysing some discomfort I was having with my shoulders, and I looked at myself sleeping on one pillow on my side, and like my head was dropped like that. And then when I put two pillows on, it felt like my head was really high, but it actually lined my spine up, and that make you
Yeah,
feel
so that
better.
could be one thing. And so when it comes to sleeping, and this happens with shoulder pain as well, like, and it's as I was talking about with passive and active structures, like when you're asleep, it's your passive structures are taking like like they're in that position because your muscles are basically just switched off for the evening and you're lying there. And so that's why like that positional sort of stuff can be really helpful. So for people who do struggle with it, often with lower back pain, chucking a pillow underneath your legs if you sleep on your back. So instead of being legs flat, slightly under your back, or if you're sleeping on your side, putting a pillow in between your legs to keep that neutral, and then looking at the pillows as well, about to trying to keep your neck in a position that it likes. But yeah, if you're just drunk and you passed out on the couch, then that's probably that's something different entirely. But yeah, so when Adam Maliani's saying he's just slept with an odd position 2 nights ago, and so hopefully with this thing where it's like just come on quickly and sort of acutely, generally that will mean just keep yourself a bit entertained with other exercise and let it sort itself out quickly. If it's something that does stick around though, getting some targeted strengthening work into the neck can be a really good idea. I've started doing one with a few patients where it's just getting a fairly low level like resistance band and getting your head into a neutral position and having the resistance band against the pole, getting your head in that neutral position and then taking a step forward, just a little step forward. So you're just getting that feeling if you relaxed your head, it would pull you back, but you're just maintaining neutral. And so it's sort of this like anti-movement exercise. So you're basically just holding neutral against an isometric force. So, and then turning to the side, taking a side step to get a bit of that lateral flexion, and then turning around so you get the extension, and then and again to the other side so you're getting the lateral flexion as well. But again, this is a podcast. Don't try out funky neck exercises probably if you haven't tried it before. But that there's ways in which you can progressively overload neck strength just to get that little bit of muscular stimulus. The other thing that often causes neck pain in people is if they're doing their upper body exercises and haven't got very good scapular control and if they're very active through the upper traps and in that hunchy sort of position, then often that can be quite an overloading thing for and cause neck pain. Now, just with because I did want to give a bit more of an overview around like when it's a good idea to be looking at like definitely getting medical intervention. So seeing a physio or a doctor is if you're getting some nerve signs and symptoms, so pain like tingling or numbness down the leg or arms, that's a good sign that you want to make sure you know what's causing that, particularly if it's like large areas and really numb or really tingling, then definitely get that looked at. But again, if you do have like just bits of tingling and numbness, it doesn't mean the end of the world. It doesn't necessarily mean something horrible has gone wrong. It really can be quite normal, but it's worthwhile being quite sure about that. If you have any bladder or bowel changes, that's actually, that might sound pretty weird to people, but if you have like especially numbness around your groin area, and then if you have any bladder or bowel changes, that's a sign that you should definitely be getting things looked at. And pain overnight, like if you have a position like you were saying where you would get pain that would potentially like wake you up if you're sleeping on your front, but then you could change positions and be on your side or be on your back and it would go away, then that's generally okay, and that's just quite a positional thing. But if you do get pain at night where it wakes you up and you just can't get back to sleep, no matter what position you're in, it really is like quite a horrible feeling, then that's a sign that you should definitely go and get things medically looked at. I'd like to give you guys this information so you can have be a bit more informed about I guess when it's like try out looking after yourself versus definitely go and get things looked at. So they're the kind of the main things to be aware of with back pain.
My advice would be my 2 cents at the end of the show is don't live on painkillers. If you're experiencing back pain and you use painkillers as a go-to just as a daily thing, that's something you really want to look into, and you want to see if you can I use painkillers rarely if I need them, but not just as a go-to.
Yeah, and if like in acute stages, if it's like something that's just like real bad and you have to use them for a short term, fine. If it's using them as a tool to facilitate training, like good. But if it's just like that's all that gets you through the day, then there's so many things you can do for it. But it is so hard, and that's why there's an absolute like pandemic of painkillers around the world. Like it is really bad. But hopefully this has been helpful for you guys. Yeah, I mean, there's so much more with that I kind of wanted to get into around like surgical interventions and scoliosis and postural whatevers, but yeah.
Maybe we can talk about a bit of that tomorrow.
Anyway, there's always more that we can talk about with this stuff.
Yeah.
I get excited.
And look, another thing, if you've never looked into it, never done it, spinal mobility is a huge part of preventing back pain. For me, I used to need to do more to not experience back pain until I knew how to do spinal mobility. And now that I know how to do spinal mobility, just by doing this kind of thing daily, when I used to say I used to do nothing and I'd get pain, I can do nothing but spine mobility and not get pain, because it just keeps everything moving, you know?
Yeah, and just on that, like we did talk about this a little bit the other day, but when you have, if you've got, you know, however many joints in your spine, lots, if you're very stiff through lots of them and you're getting, so all your movement is coming from, you know, one or two joints, then that one or two joints is going to take much more of the load. Whereas if you are spreading the movement between all of the joints, then each of the individual joints is going to have much less load. So that's just a reason why spine mobility is so nice for that. And motion is
Perfect.
lotion. Motion is lotion, baby.
Yeah, that's
Motion
it.
is lotion.
Thanks, Phil. Thanks so much. And thanks, everyone,
Pleasure.
for tuning in. And we'll see you guys tomorrow to wrap up a great week of injury management.
Health is about performance, not just body image.
You better be willing to accept what you're going to have to do to get there.
We'll start focusing on movement goals, strength goals, flexibility goals.
When you nail that skill, it's there forever.
The body image goal doesn't get you that
It's the
far.
consistency and frequency that's going to get you there. It's not the intensity.
There's no shortcuts to mastery and movement. Destination doesn't change overnight, but your direction will.
The gym is not the place to beat up the body that you hate. It's the place to build the body that you love.
We are the gym that teaches people how to move instead of just exercise, because we believe that health is about performance, not just body image.